Hello, my name is Jeff Taylor, and I'm one of the Community Advisory Board members at the UC San Diego Antiviral Research Center. And I'm here today with two researchers from UCSD's Center for AIDS Research, Dr. Sara Gianella and Dr. Davey Smith. And we're talking today about HIV cure research, which has been receiving a lot of attention and making a lot of really exciting progress. But I guess there are some challenges. Would you like to speak to what those are?
Yes, sure. So the HIV reservoir is the main challenge to curing HIV, and one of the reasons why this is so challenging is because it's not only in blood, but the HIV reservoir also goes into all the tissues, like the brain and the heart and fat and everywhere, and so it's very hard to understand where and how it spreads during HIV infection and how to reach it.
Sure. You know, I know they do sample these tissues. I've been in studies where they've taken lymph node and fat tissues. What are the other reservoirs that you can't reach that are a challenge?
So it is very challenging to reach the deeper tissue reservoir in living people. As part of some studies, we do sample lymph nodes, we do collect semen, we do collect cerebrospinal fluid. Sometimes we also do small gut tissue, but this is not representative of the entire reservoir. There are deep reservoir, lungs and brain and heart and liver that are not easy to access in living people.
So I understand you have a new program that seeks to address that. Do you want to speak more to that?
Sure. We're starting a cohort called the Last Gift cohort, and it's where HIV-infected individuals who are terminally ill, usually with something else like cancer, heart disease, etc., and they only have 6 months left to live, and usually within some sort of hospice program. And we engage these individuals to see if they're interested in HIV cure research, to understand more about the reservoirs that Sara was talking about. And we follow them very closely right up until the time they die, and then when they die we collect their bodies for rapid autopsy and then collect these tissues and then to look for all the places that HIV is hiding.
That sounds really exciting. It also sounds kind of expensive. How are you?
It is expensive. We have a grant to look at setting up this cohort, but we also have partners with people who are very interested in this as well. So other research grants like the California Neurotissue Network and the other national programs that have these autopsy studies. The difference is that in those autopsy studies, they don't follow them as closely right before they die. So they don't quite understand what's going on in the blood and then also in the tissues. So this gives us an opportunity to look at both.
So that should really help advance the field, because that's a lot of data that we don't have access to right now.
We're hoping that it answers real clear questions about how we measure HIV in the blood. How does that relate to all the other reservoirs in the brain and the liver and the spleen, etc.? Because right now we don't have a good picture of if we do something that causes the reservoir to drop in the blood and we can measure that while someone's alive, what does that actually say about the reservoir that's in the brain or the liver? So this should give us an opportunity to correlate those two and see if they match or don't match.
So how will you kind of get the word out to the patient community and the people that you want to eventually recruit for this innovative project?
We're talking to you now, and so thank you very much for doing this, and also thank you for all the advocacy that you do within our community, because that is exactly how we get the word about. We're also trying to partner with television stations and newspapers and other community groups, and then go around and talk about these issues. It's not always easy, because in America we don't talk about death too much, and yet we all have to go through it sometime, and yet many times people think that that is also a time where they're able to give, and that's why we call our cohort the last gift. So it's this one cohort, this one opportunity at the end of their lives to sort of participate or give back to humanity. And the more we've talked about it to people, the more they're very open to it. They're like, yeah, this is, especially people who are at the end of their lives thinking this is my one chance to give my one last thing back, which is very endearing and heartwarming.
Well, certainly that's been the history of the AIDS epidemic, right? The people living with HIV have realized, how important research has been to keeping them alive. And as you say, even at the end of life, I know a lot of people who've been living a long time with HIV are interested in research, but are frustrated that they can't participate. So this might be one way they can participate, even though they're nearing the end of their life.
When I first started my research career doing medicine, the hospital was full of HIV-infected individuals who were dying, and a large number of them participated in these clinical trials to start figuring out which drugs worked and which drugs didn't work. And they gave up their blood and their brains and their bone and every single bits of themselves, and most of them died. But it was because of that altruism that we have the drugs that we have today. And I think that the HIV community has had a very long history of being altruistic, and that's the reason we have all the advances. So it doesn't surprise me that we have so many people, honestly, who are very interested in sort of this work, even at the end of their life.
Yeah, well, certainly Corinne Dubé and others have been doing work in the HIV cure arena, because some of the studies are going to be very invasive and potentially dangerous drugs that won't benefit them. And quite frankly, the HIV drugs we have today are very effective in keeping people alive and healthy and having a good quality of life. And they've been, again, very surprised at how willing people are to take those risks, provided they understand them. That kind of altruism continues to this day, and before it was literally like life or death, and people really didn't have anything to lose. And
actually, in one of our, Davey, in one of the survey that we did, and we surveyed HIV infected and uninfected people, and we asked them many questions. Mm-hmm. And one of the surprise that came out from this survey is that HIV infected people, both groups were positively in favor of mm-hmm. end-of-life research, but HIV-infected people were more likely to give up weeks of life at the end to participate to HIV research. Like a good proportion of people were willing to give up or to kind of sacrifice more than 4 weeks of life during the terminal phase if this will help HIV research or the community, which was really surprising. It was nice to see.
Yeah, it's very heartwarming.
Yes, heartwarming.
Terrific. So what are your next steps in terms of getting this project off the ground?
So we've engaged our pathology partners, and we've got procedures set up to do these autopsies very quickly. Mm-hmm. So when somebody passes, then we have to be able to do the autopsies quickly to preserve all the HIV that's there and in the right places. Mm-hmm. And then we're engaging the community to start enrolling people. And then we're going to stepwise increase as much as our funding allows. But the next step, as Sara mentioned, is that one part of it is observational, so that's where we are now. Mm-hmm. And then the next step will look towards interventional stuff. So it turns out, as you alluded to, that people at the end of their life are willing to take greater risks than people who are healthy and on HIV therapy and are going to live a long, healthy life anyway. And in those individuals, it might be best to test some things that are more risky. And they would be able to tolerate more of those risks and even sacrifice, shorten their lifespans even further, just to be able to participate. And we're engaging bioethicists about these questions and talking about whether it's ethical to allow people to participate or it's ethical to keep people from participating, because now that's a big question of just because I'm at the end of my life, that doesn't mean that I shouldn't be able to participate in research, which I think is fascinating.
Yeah, and certainly from a patient perspective, people want to have that choice. It's very infantilizing to have an ethics board say you can't do this.
Can't do that.
I mean, you're going to die anyway, right? So, I mean, that was the argument at the beginning of the epidemic, where they had some kind of the same restrictions, and people pushed back and said, no, we have the right to do this. It's our lives, and there's so much good that can be accomplished. Terrific. Well, is there any way people should learn more about the project, or a website that people can turn to find out what's happening?
So at the moment, we're just getting our website set up.
Okay.
Probably at the moment, the best place to go to is the California Neuro Tissue Network. Okay. So that's our partners for our pathology studies, and we'll be attaching more information to that website soon. But people can always contact us at UCSD CFAR, and then we'll be happy to answer any questions, or if they want to participate, we're happy to answer that too.
Terrific. Well, thank you so much for sharing about this very exciting project.
Thanks for interviewing us.
Thank you.
Thank you.